Hey guys, I'm going to be doing the FABER and FADIR's test. And just a little disclaimer before I begin to show you this test is very important to communicate with your patient during these tests, because the more you communicate with your patient, the more you can differentiate what structures are being affected while you're testing your patient in these positions. So the first test I'm going to do is the FABER's. So you're going to have your patient go into a figure 4 position. So bring their leg on the opposite side of the knee. And while you stabilize the opposite hip, and then put your hand on the knee that's closest to you, you have a passive overpressure on it, and if they would feel any pain either on the anterior side of their hip or on the posterior side of their hip. If it's on the anterior side, it could be potential stretching, like any stretching or a anterior capsule pathology, or if they feel any compression on the posterior side, it could be posterior capsular pathology. And then now to the FADIR's test, you're going to have your patient still be laying in supine, except you're going to bring their leg into about 90 degrees of hip flexion, and then go into adduction, and then internal rotation. And once again, if you communicate with your patient whether they're feeling pain during this, and if the patient's feeling pain on the posterior side, it could be some stretching of the posterior capsule, and if there's any pain on the anterior side, it could be potential like any compression on that capsular or any of like the muscles involved.